Okay, so now this is going to be the audio lecture for chapters 14 and 15. I will tell you these are some very short slides, so therefore this is a very short chapter. So we know secondary care, of course, is the care for treating the diagnosis and illness that we have been given from the physician in the primary care disease state. Secondary care may include ambulatory medical services. Sometimes it may include acute care services. The level of intensity is higher. Sometimes patients have to stay longer than anticipated when they go through a secondary care provider service. The primary goal, of course, is to detect illness in early stages. Okay, because keep in mind, if you can prevent it in stage number 1, that is great. That's awesome. Here we go again with who provides the care. Of course, physician, hospitals, urgent care centers. You got your childbirth centers. Some examples of secondary care services include colonoscopies, MRIs, tomography, scans, mammograms, surgery. Access to secondary care, five things surrounding that. Okay, so let's look at, let's take a couple of these and just kind of look at them. So access to secondary care. So let's look at geographic. You may ask yourself, well, how does geographic have anything to do with secondary care? Well, geographical location. So let's take an area that's not a rich area. Okay, let's just say the individuals living in that area, one segment is like low income. Let's just say you have individuals in another segment that are mid-level in income. Who do you think will have the most visits to the doctor's office? Right, the one that doesn't have the insurance are usually the ones that tend to want to utilize the physician services more. So that is an example of geographical. Of course, we know financial barriers is going to always be that number one hot topic, which is health insurance. Okay, chapter 15, long-term care. Do we have to have we'll always have to have long-term care services. And so with long-term care, there comes a variety of services or a range of services offered, be it nursing, social, or rehab services. Those individuals are taken care of 24/7. Long-term care facilities do not shut down. Long-term care can be for anybody of any age, but most people, most are under the age of 65, but you have quite a few who are over that age. Basically, long-term care is designed to restore a person back, help to restore their functionality back. The greatest payer or the LTC payer of greatest insignificance or significance is not Medicare, as many people may think, but Medicaid is actually one of the top payers for long-term care services. Long-term care is costly. Okay, so basically, you know, when patients are shopping around, they really have to shop around for the price that is more feasible for their budget or for their monies. But long-term care can be costly. Who provides secondary care? Just pretty much like we did with the first slide, primary care. So that may be nursing homes that provide that care. It may be care given into a patient's home. It may even be, you got your mental hospitals. And a lot of people don't realize that, but mental health patients go to the doctor and this and that, just like you and I. It's just that they have a facility that is designed and set up for them, and the individuals working at facility all have been trained on how to take care of the mentally ill patients and their healthcare needs. Long-term care facilities, again, can be intermediate, rehab, or skilled nursing. How is it financed? A lot of financing for long-term care is done through public sources, but again, remember, Medicaid is the greatest payer. So when we look at Medicare, just to give you a few tips about Medicare or a few facts about Medicare, Medicare does cover skilled nursing for individuals who require long-term care. They do it for about 100 days, and whatever needs need to be met for Medicare in order to make sure that person is qualified to benefit from those services, then that's what will happen. Medicaid supports home care services that patients may need. Their funds support hospice. They also will pay for skilled nursing for patients, as well as any kind of rehab a patient may need to have. With Medicaid, you still have your mental health centers, and you have your adult daycare centers, you have your case management department. Long-term care utilization issues, like anything else, most of the time, individuals that live in rural areas will usually have a hard time looking for a long-term care facility. Okay. So where are we now with long-term care? What's our current state? Well, one of the issues is managing the organization. It is hard to find good managers for long-term care services because, again, you're talking about an operation that operates 24/7 and never shuts down. It takes a very good manager to help the doctor with making sure that you all are managing a patient's healthcare needs as you see feasible. All right, this concludes the lectures for chapters 14 and 15. Thank you.